Good evening, wherever place you are joining us from. It's good evening here. I hope you're well. Karibu sana. So today we'll be delving into a very important matter about responding to a question: who funds our vaccines? You know, vaccines are life-saving public health measures, but who funds them? For example, in Kenya, who pays for our vaccines? I know this is a question that every other day we get to ask ourselves, and we even get to ask even the government. So the the global Alliance for Vaccine Initiative, abbreviated as Gavi, has been the major financier for our vaccine. Did you know this? So Gavi, the alliance, has been having three main funding mechanisms, or three funding phases for our vaccines. So the first phase is what they call self-financing, and this is where countries during their first year of being funded by Gavi contribute only 0.2 of a dollar per every dose of the vaccine that will be delivered, and this is the first year. Now, the other costs are covered by Gavi. Now, in second year, countries transition to something we called the preparatory phase of vaccine financing. The preparatory phase, this is where countries pay at least 15% of the costs of each and every dose of vaccine. And the third phase is where countries transition to something we're calling accelerated phase of vaccine financing. And this is where Gavi financing reduces and the country's domestic financing for its own vaccines has to increase. For example, in Kenya transitioned from the preparatory phase to the accelerated phase back in 2022, when its gross national income exceeded the Gavi's threshold for the preparatory phase. So Kenya's GDP was less than 1700 USD per capita, and in 2022 it hit 1900 USD per capita, so exceeding Gavi's threshold for preparatory phase. So Kenya transitioned to the accelerated phase of Gavi financing phase for vaccines, and that is where our country is, Kenya. So Kenya is required to contribute a bigger chunk of its resources towards financing our own vaccines, and Gavi is working towards preparing Kenya towards self-financing of vaccines, and this is expected by the year 2030. Kenya should be self-sufficient in terms of vaccine self-financing. So what is the take-home message here? Number one, Gavi was financing both vaccines, vaccine commodities, and operational cost for vaccines. As Gavi financing goes down, Kenya has to prepare to fund not just the commodities, the vaccines, but it has to scale up its resources to finance operational costs, because procuring vaccines is not sufficient if we don't finance the delivery of these vaccines to the people who need these vaccines. The second most important point: the time is now. We are having health system reforms in Kenya. Health system reforms ranging from developing a new health insurance model up to the point we are now developing a new health benefits package. This creates a policy window for us to hardware long-term strategies for vaccine financing in our healthcare system and achieve self-vaccine financing strategies by the year 2030, because this is crucial. If we don't have sustainable financing for vaccines, we'll have issues around stockouts. We'll also have issues around vaccines have been procured, but they cannot be delivered to the people who need them, probably because our cold chain systems are insufficient, and our delivery systems are insufficient, and healthcare workers who should be delivering some of these vaccines are not there or are not sufficient. So who funds our vaccines? And let's keep this conversation going. Let me know what you're thinking about this critical issue of vaccine financing in your country and in Kenya. Thank you.